Hey, good evening, everyone. Happy Monday. This is Stephanie. In my segment tonight, I'd like to give a brief discussion about uterine fibroids. I'll also read an excerpt from a story entitled Strangers in Peoria, where two characters meet in a restaurant and they discuss their professions, and one of the characters is an OBGYN. So, July is what's known as Uterine Fibroids Awareness Month, and some of you are aware of that, and others may have never heard of fibroids. Fibroids are benign or non-cancerous tumors that can grow inside as well as outside of a woman's uterus. If you've never heard of a uterus is the major female reproductive organ in a woman's body. This is where a baby is grown when she's pregnant, and it also helps alleviate the body of unused eggs during her menstrual cycle. Now, what happens when a woman has uterine fibroids? As these tumors grow in the woman's uterus or on the outside of the uterus, it can cause complications during her menstrual cycle. It can also cause complications during pregnancy if she becomes pregnant, and it can also cause infertility where a woman is not able to get pregnant because of their presence. Now, there are generally three different types of uterine fibroids. You have what's known as submucosal. These are the ones that grow inside the uterine cavity. You also have what's called intramural fibroids that grow inside the muscle lining of the uterus. And then you have subserosal fibroids that grow on the outside of the uterus. Fibroids generally feed on blood flow as well as high levels of estrogen in the blood. That's what makes them grow. So naturally, as a woman who's suffering from this condition, as she does her research, she's going to implement different natural ways to decrease levels of hormone in her blood by eating food that does not have high amounts of hormone in them, changing her diet. Some eliminate meat altogether, as well as exercise to lose weight and to just help the body be healthier in itself. Studies have shown that women who are overweight do suffer from fibroids more than women who are not. So that's something to take into consideration. And other studies have shown that women of color, particularly African American women, suffer more with fibroids than other demographics. So that's something else to take into consideration. Although generally women of all races and cultures, women during their child rearing years are known to suffer from this condition. Now, there are different ways to treat the condition and to also treat the symptoms. Many times, traditionally, doctors have been known to tell women you need a hysterectomy, a total hysterectomy altogether, which is where the entire uterus is extracted from the body. There are other options, and of course consult with your physician if you're finding or someone you know is having an issue with fibroids. You want to consult with your doctor to find out the best treatment option for you and your condition, your challenges with the fibroids. Two other options are having a myomectomy, which is having the fibroid tumors removed from the uterus. And then the last one is what's called a uterine fibroid embolization, where the blood flow is cut off from the tumor itself so that it can shrivel up and dissolve. All right, natural remedies again are diet, exercise. You may see advertised on the net, on Facebook, apple cider vinegar and how it could help. But be careful with apple cider vinegar because it's very acidic. You want to dilute it, and you also don't want to take it in large amount or large quantity because it can cause high blood pressure in some people. So be careful with that. I've also seen advertisement for castor oil packets. Do what you can, to help yourself, and also consult a physician to find out what the best treatment option is for you. Now I'm raising awareness because I have a personal experience with fibroids. My journey, my battle with fibroids started back in 2008 as I was beginning my career as an English professor. My body was going through lots of changes at that time. I didn't know what was happening. Once a month, I would have this issue of heavy bleeding and heavy cramping. I would generally be able to make it to work most months, but some months I was not able to. I had to take the day off. And if I was able to go into the office during that time, I was in the bathroom every 30 minutes to an hour taking care of myself. And that's no way to live. I suffered in silence for the most part. I told close family members what was happening. and I consulted my physician to find out the best way to meet the challenge of that problem. And I began my journey of naturopathy at that time. I changed my diet. I began to exercise and started, to lose weight to help myself. Now, as years went on, I was able to pretty much eradicate the symptoms. In 2011, about 3 years later, I got married and I became pregnant. I was pregnant with twins. And unfortunately, I was not able to carry that pregnancy to term because the fibroids sucked up all the blood and the estrogen, the hormones needed for the fetuses to grow. So I was not able to have those babies. And this is a common problem. Again, if you find yourself suffering from fibroids, if this message reaches you, do not suffer in silence. Speak to your family, those you trust and you know who love you and who care. And then also talk to a physician to find out the best treatment option for you. Now, with all that being said, at the end of my battle with fibroids 3 years ago in 2014, June of 2014, I said enough was enough. I began to have challenges and issues again with the fibroids. And my doctor at that time, after taking a look at my uterus, he suggested a myomectomy, which is removing the tumors. So I had the myomectomy, and as I was waking up from that procedure, my doctor doesn't know this, but as I was waking up, I saw him sitting on the side of my bed with his head down. And I heard him say, "I will not let you die." And at that moment, I knew that I could really trust that doctor. I had been praying the entire time, but I prayed again, and it was confirmed, hey, I can trust this doctor. And I knew that my situation at that point was life or death. He told me the severity of my condition. My uterus had stretched from my pelvic region all the way to just below my rib cage. So my uterus had stretched to the size of a watermelon. During my myomectomy, he removed 4 fibroids. 3 were the size of grapefruit, and 1 was the size of an orange. So at that point, I knew that it was time to make a major decision if I wanted to have the quality of life that I wanted to have. And I definitely wanted to be happy and to be comfortable with my body and not to feel hindered in any way. He told me that the lining of my uterus had basically become fibroids. There were clusters, and that if he continued with the myomectomy procedure to just cut away the fibroids, there really wouldn't be much of a uterus left. So at that moment, I said, hey, you know what? Let's just do the total hysterectomy. So at the age of 39, my entire uterus was extracted from my body, meaning that I do not have the major reproductive organ that is needed for a woman to carry a fetus or carry a baby to term. Now, because nothing was wrong with my ovaries or my fallopian tubes, I still have my ovaries, I still produce eggs, and I still have my fallopian tubes. And so, therefore, I'm still able to have my own children via other methods, like a surrogate. And if I choose to adopt, that's an option as well. So I'm still able to have and care for children. Of course, again, if you find yourself suffering with fibroids and not knowing which option is best for you to meet the challenge and to eradicate yourself of this issue, speak to a physician. Consider what it is that you want in your future. Whether you want to still be able or to have the possibility of having children, there are options that are best for that. Or if you've had children and you don't see yourself having more, or your condition is so severe like mine was, where having the uterus would still not allow you to have children, then that's something else to consider. And I would say pray, consult family members who it also may impact, and make the best decision for yourself. All right, so at this time, what I'm going to do is read the excerpt from Strangers in Peoria. And again, the story is about 2 people who meet in a restaurant and they begin discussing their professions. And one happens to be an OBGYN. All right, so here we go. Actually, my patients have a choice, she said. They can let me do the surgery or they can buy a pessary, a device few women know anything about until I pull a sample from the cabinet and explain its ins and outs. The pessary makes surgery seem simple. All we have to do then is pick a day for me to tuck the lady's organs back where they belong. I said, a procedure like that sounded painful, even allowing for an anesthetic. It sounded much worse, I said, than a colonoscopy, a procedure I'd become acquainted with early in life due to family history. She nodded slightly and continued, now, if the lady's womb is full of fibroids, I'll suggest we take the uterus out as well. I'll tell her we'll remove the crib and leave her playpen intact. Often that's the best solution. She sipped her Coke again and said, somewhere in Peoria, as we speak, a bladder's dropping, a rectum's quivering, and a fibroid's growing. Believe me, if the salary is right, I'll take this job because a fibroid in Peoria is no different than a fibroid in New York. All right, that was an excerpt from Strangers in Peoria. Again, that story talks about two people meeting in a restaurant and striking up a conversation about their professions, and one of the characters happens to be a female OBGYN. Now, what's significant about that particular passage with regards to fibroids awareness is that we see that this is a condition that affects women everywhere. All women of child-rearing age can have issues with these tumors growing inside and outside of their uterus. So therefore, we know that we are not alone. There are many support groups to help women in the throes of the battle with fibroids, as well as those who have done what they needed to do, what was appropriate for them to resolve the issue. Have an awesome day. Hug someone, tell them you love them. Let them know, if you know that they're suffering from fibroids, let them know that they are not alone, and help them seek help for their condition. Have a blessed day. Bye-bye.